Oh, we're live. Apologies, guys. Apologies for being a little bit late. Blame Amber. Blame Amber.
No, blame Amber technology. I have been here for 20 minutes.
No, it's all good. It's lovely to see you guys. This is the lovely Dr. Amber Batson and the amazing Daniel Shaw. Unfortunately, the beautiful Andrew Hale can't join us today because he's in a caravan with no signal. Who would have thought? But I am still extremely excited to have you guys come and join us so that we can talk about something that's really important to me. The Chronic Pain Symposium is looming. And I'm really hoping that tonight we can have a chinwag about why we're doing it so people can get behind the mission that we are on. Reflect back on a few of the lectures last year. Amber, you were very much present. And then possibly even talk about what's happening this year. That's the intention of tonight, guys. So by all means, if you have questions, please do put them in the box. You know, this is an interactive. But I'm going to start with telling everybody about what is happening. So on the 25th to the 28th of April, we are hosting an online conference. It's a global event. And what that basically means is that anybody around the world can watch it within their time zone. So they can watch it during daylight hours. They don't have to get up at 3 o'clock in the morning. They don't have to kind of, get home from work and rush. They can make it fit them. So all the lectures will be available as a recording. Why did I say like recording? As a recording within 2 hours of being presented. And they're going to be available for the next 20 hours. So every day has a 24-hour window where those lectures are available for you to watch at your own convenience. It's 4 days. Bite-sized Friday, 15 minutes of just bouncing around the world of chronic pain. So many different things. There's going to be about sleep. There's going to be about anxiety. There's going to be about therapies. There's going to be about medications. Then on the Saturday, it's the OA journey. And we're going to be following a case of osteoarthritis from puppyhood, sadly, to grave. And we're going to be following a journey that many first opinion practitioners experience. And that's going to give people a greater understanding about this common condition. And then on Sunday and Monday, we've got 2 expert days. And these are 11-hour days where we've got key opinion leaders from around the world who are talking about all elements of chronic pain, not just osteoarthritis, but we've got visceral pain, so gut-related discomfort, abdominal pain. We've also got dental pain. So we're expanding our reach.
Did you get that?
Yes.
That was teeth and ears. Yeah.
And we've got ears.
Oh, yeah. It's exciting, isn't it?
Yeah.
I'm excited.
Got Joe Murrell and Sue Patterson talking about ear disease, something that I think we really neglect. So all in all, it's a massive, massive symposium and it's free. I find it's so mental when I say that. So it's free of charge to attend. And you only, if you want the recordings, it's a VIP ticket and that's £125, which I hope that people will partake with because that is what's going to fund CAM keeping going.
Can I ask a question?
Yes, you can.
Okay. As a member of the audience, just because so that I understand, because I think if I don't understand, probably there's lots of people who don't understand. So you said a moment ago that this there's access because each webinar is being recorded and it's available for 20 hours, so you can watch it at any time.
Yes.
You say it's free, and if you're signed in free, does that apply to you? Or
yes.
That's 20. Yeah, that's what I thought. But I'm just checking. So if I want to watch something, this osteoarthritis journey on Saturday, but I can't watch it at the time because of my time zone. I've signed in for free, but I can't make the 9 o'clock bit, but I could watch it at 12 o'clock.
Yes.
It's free for that 24 hours, isn't it?
Yes.
If I want the recordings for a much longer time because I can't make the weekend and I want to watch it in May or October, then I have to pay the £125.
Yes.
Right, perfect. Because if I didn't understand that, I bet you there's people out there who are confused about that.
If it sounds too good to be true, it's because it is. We are really committed to making sure that there's no barriers to people learning more about chronic pain, because I personally feel it's a hugely neglected element of vet medicine, and that's what we're going to talk about between the three of us in a bit. So we wanted to make sure that there was absolutely no reason that people couldn't come and join us. we also believe that chronic pain needs to be managed by an interdisciplinary team, which means that we have different stakeholders, different caretakers in that care plan. We might have the vet nurse, we've definitely got the caregiver, we've got a physiotherapist, we've got the dog trainer, we've got the groomer. All these people have a massive impact on managing chronic pain. And everybody in that sphere has different CPD allowances. You have different budgets. So on much negotiation, we're like, well, we've got to make it free, haven't we? If we want all these people to come, it's got to be free. We also really want to support other countries, really up their understanding with regards to chronic pain. And with the huge global reach we're pushing for, there's going to be lots and lots of vets and other canine professionals that don't have the financial capacity to pay for CPD. So it was another reason to make it free. So many, many reasons. Impressed?
It's going to be brilliant.
So the reason I've brought these guys together, unfortunately, as I say, Andy's not here, is that we all partake in a little bit of education, don't we? So Dan runs Animal Behaviour Kent. You do your conferences once a year. You're always doing webinars and lectures. You're here, there and everywhere. And then we've got Dr. Amber Batson, who for many, shall I say decades, has been doing Understand Animals. So you've been lecturing around the world.
Yeah.
Nearly.
2007,
over a decade. Yeah, exactly.
Apparently.
Really. So I brought together these guys because we've all got a passion about education. We understand why we do it at great harm to ourselves a lot of the time. But we've also got interest in chronic pain management. All of us have been lecturing at some point about it. So I thought it was a perfect mix to now actually talk about why the concept of a symposium devoted to chronic pain is important. And I'm going to throw that over to Dan. I'm going to ask you, why do you personally think that an event like this is really important?
Oh, well, I'm super excited for the event, because I think what I love that you're doing and what I love that this event does is it really opens up, I think, conversations that maybe would feel a little bit difficult for some industries to kind of feel like, oh, I don't really know what I'm talking about, learning about all this stuff about chronic pain, teeth, ears, all these things, but to kind of learn about actually what you can contribute to supporting an animal that may be experiencing chronic pain. If you're a groomer, for instance, or if you're a dog groomer, or a dog trainer, or working in rescue. And I think it's what I love about in terms of this event is that there is so much that we can do, that not just being in the veterinary profession, but beyond the veterinary profession, to support with the treatment of chronic pain, to help identify signs that an animal might be experiencing chronic pain, to help feedback whether a particular treatment protocol for chronic pain seems to be working for an animal, whether we seem to be seeing behavioral changes, whether we are seeing a dog doing better when they go for their grooming treatment, all these sorts of things. And I think, if we look at the lecture topics, there's so many things that dive into stuff that you kind of think, oh God, actually, I'd really love to know about that in my job. I don't know anything about that in my job. I don't see much CPD that comes up that's relevant to that topic on my job. Long-term kind of, there's a few things I know about sort of long-term recovery from animals. And I'm obviously butchering here the lecture title, so you may remember better than me, Hannah, but kind of helping animals that are kind of on that sort of recovery programs, and all that sort of stuff isn't just obviously relevant for the veterinary team, but it's relevant for anyone that's working with the animal, to make sure we're keeping that animal on track and making sure we're not doing anything that's going to be sort of counter what we're trying to do in terms of helping that animal recover or manage a treatment protocol. So yeah, super excited. I think it's super important for everyone. Yeah.
What about you, Amber? What's your thoughts? Because I have to say to everybody now, I love this woman because she's been a dear friend to me for many years now. And I think you've known how difficult the journey is. So I know that you have an understanding of what we're trying to do, because you have been working with pain and behaviour decades, and really been hitting your head against the wall on many occasions, haven't you?
Really want me to open that can? Yeah. I mean, when I first started talking about pain and behaviour, it was before many of the publications which are often discussed and referenced now had even been, well, certainly haven't been published. I don't think they'd really even been apples in their researchers' eyes. And you know, and I'm not trying to say, oh yeah, that makes me special, because I recognized it. I think people knew about, you know, but people didn't know where to go. And it's been when I look back over, you know, I don't want to do some retrospective thing, but, you know, I've been a vet 26, 27 years. And it's, you know, the journey in that time has been phenomenal. And, you know, I totally, like you and like many, still feel, though, that we're at a point where we don't offer the caregiver or the guardian for the animal enough support. And that's not meant to be a criticism of the veterinary industry, of the, you know, complementary therapy industry, the guardians themselves, anybody. It's just that there's a lot to consider, and actually, and everyone's living really busy lives. And I think since the pandemic, that seems to have got worse. And, you know, as a result of that, we don't always have the time, any of us, to dedicate what we'd really like to supporting. So we need symposiums like this to raise awareness, to motivate people to go out there and be able to do their bit, wherever their bit is. And their bit, whether, like Dan just said, whether or not it's a, you know, them as a groomer or a hydrotherapist, a physiotherapist, a vet nurse, a vet receptionist, the guardians themselves, whoever it is, that we all play our part in that potential pain journey and support journey for the caregiver, and most importantly, the animal themselves. And, you know, and it's actually, arguably, one isn't necessarily more important than the other. Yes, we need a diagnosis where we can get it. We can't always get it. So, you know, we treat the patient, not the imaging and all of that stuff. And nobody, I truly believe, I'm at the point now where I believe that the most important role is supporting the caregiver as much as the dog. And, you know, and saying it's as important, you know, not necessarily more important. And I feel that we're still not able to do that very well, and we'll never be able to do that well enough if we don't all collaborate and come together, which for me is why it's so important what the work that you have done, Hannah, through CAM, to try to elevate that awareness across not just the veterinary industry, but all manner of industries and individuals who contribute to the potential well-being of an animal like the dog. That's what we need. We need more awareness, and it doesn't have to be about degrees and PhD. You know, I've just been speaking at a veterinary conference this weekend, and, you know, a lot of the speakers have PhDs and, you know, etc. And that's marvelous, and it's absolutely wonderful. But that doesn't mean to say that what they bring is any more valuable than the groomer who's been working with dogs for 20 years or the trainer who's been doing it for 10 years, etc. We all have our role to play, and you've highlighted that. And if we can all come together and collaborate effectively, it's better for the dog, it's better for the caregiver, it's better for all of us.
Yeah, 100%. And I'm loving the fact that people are putting stuff in the messages, so please carry on. It's nice to meet you, Chrissy. Thank you so much for commenting about how pain is a huge part of your evaluation. Absolutely. Thank you, Kerry. Totally understand in rescue it is difficult to differentiate stress, and then hopefully, and I don't mean to plug, but maybe there will be some things in the symposium that will help you guys separate stress, contextual stress, from actually underlying pain. So it's really great, and thanks, Jill, for loving Amber. I love Amber too. I'm 100%.
Thanks, Jill.
Yeah. Thanks, Jill. Yeah, so the symposium, I guess I'm a little bit of a rhinoceros. I'm a bit headstrong, and I have had so many people approach me over the last 10 years whinging. Now I'm going to do it. I'm going to go where I shouldn't go. There's a lot of whinging. There's a lot of blame. There's a lot of pushback. There's a lot of non-collaboration, and there's always somebody else's fault, and that's a horrible thing for me to say. And I really wanted to create a symposium where we're all put in a room we're all put in a room and we all learn together, and we all kind of have that same experience to which we can learn to collaborate better. And I felt that people were learning in different rooms, they're going on different journeys, and then they don't marry up very well at a later date. Whereas this is supposed to be like a unifying experience where people go, oh yeah, I heard that too. Yeah, oh no, I'm totally on the same track as you. So that was one element of it. But also, having been really fascinated of chronic pain, I realized that how the team can make or break a case. And I'll give you an example, and no offense to groomers. I had a case where we were really just beginning to get somewhere, and then the dog went for its quarterly groom and it came back really debilitated and painful. And that wasn't the groomer's fault, because they didn't know, but the handling and the standing for long periods of time was just too much for that dog at that time, and we kind of went backwards. But then there's also situations where groomers have got in touch with vets and said, look, there's something not right with this dog. You know, I've groomed him for the last 8 years and he's never snapped at me, ever. And then the vet doesn't have the opportunity to identify where the problem is, or they've done x-rays, haven't found anything, and they assume therefore it can't be pain. So for me, I think I'm hoping that we all kind of get into the same room, put our vulnerabilities aside, because that's where pushback comes from, generally from vulnerability, and we learn together. So that's the intention. It's a little bit naive, isn't it? I can see from Amber's face, she's like, naive.
No, not at all. No, 100% not. No, and what? All right, okay, yeah, it's naive. It's naive. Naive to think that a group of narcissistic egotists who go into professions for their reasons will come together in a room and go, oh yeah, let's all agree, you know. No, but I think the people who want to be able to collaborate and be able to work with the animals that they live and work in their lives with those kind of cases better are the people who are going to show up, you know. And that's what we need. The more times we keep offering that opportunity, the more that train will pick up on passengers and carry us along, won't it? Really?
Yeah.
There will always be people. I mean, I gave a workshop not many weeks ago now, and a lady in the audience said to me, "Oh, but what happens when you've got a strong suspicion about pain in a dog because you've noticed some gait changes and you've noticed some behaviour changes." And you've recorded those things and you've given that information for the caregiver to take to the vet, and then the vet says, but I don't agree that pain affects behaviour and this animal's not in pain. And she said, what do you do? And then there will always be people, and that's not a dig at vets, because it won't always be vets. It could be the trainer, it could be the behaviourist, it could be the groomer, it could be the dog walker, it could be a whole host of it could be the guardian themselves, who doesn't believe that the dog's in pain. And that in a human behavior change model is what we call pre-contemplation. And people who are in a pre-contemplative state, you can't shift. They need that's got to come from themselves and their own considerations and desires to make that change into a particular area of knowledge. And but when you've got a symposium like this and people are past pre-contemplation and they're they recognize, okay, yeah, pain can influence behavior can influence pain. There are multiple ways in which we can influence the pain journey for an individual. Then that's what this is all about, and more people join that journey all of the time.
Yeah. But there's loads of things going through my head, and I'm going to throw this back to Dan because he's just too quiet today. One of the things that we have heard probably more than anything, and I don't mean to be rude to the vets, I'm a vet, I'm very proud to be a vet, I love my vet colleagues, is that the vet doesn't believe that there's an underlying pain component. And I do get where they're coming from. If you've got a situation where you can't clinically reason that there's pain and they're expecting you to prescribe, and that prescription could cause an adverse event, and you're sat there with, well, I could go that way and I'm not sure I totally believe you, and I could then have you coming back in a week with diarrhea blaming me that it was the wrong decision. So I can understand why it's really difficult in practice, I really do. But what we're hoping with the canine professionals that work around us, if they come to this event and they're learning from vets that us vets look up to, Duncan Lascelles, Joe Morrow, this is going to start unifying us again. Do you see what I mean? In that having the canine professionals come to a vet event, I'm hoping is going to give everybody a leg up. What do you think about that, Dan?
I think it'll be. I mean, I'm very excited to see what they're going to be chatting about. I don't remember the exact synopsis of their talks off the top of my head, but I am very excited for many of the different topics that have been raised. And I think one thing that kind of ties into that in terms of how we think about this stuff is, I think the issue that we have with pain is there's an emotional component to pain. If there wasn't an emotional component to pain, then it would be an issue, because the animals wouldn't be bothered about pain, so would keep ending up in painful scenarios and then injure themselves further. But it wouldn't be such a concern from the kind of the emotional well-being perspective in a way. So I think being able to be sort of go into that conversation with actually, obviously we've got a similar goal in terms of actually supporting the emotional well-being of the animal that's experiencing that pain. That pain is causing distress for an animal. If we can learn about kind of the considerations for someone that's going to be, or the considerations in terms of addressing different types of pain, I think that's going to be, really, really interesting.
Do you think that the canine professional world will grab the opportunity to learn from the same human textbook that the vets that they're trying to work with are continuously reading from? That's a weird analogy, but I know that for me to try and start understanding behaviorists or dog trainers, I found myself going into their worlds and going to conferences and listening to webinars and just trying to expand my knowledge, my vocabulary. Do you feel that the canine professionals could see this as a great opportunity to start learning in the vet world? Does that make sense, what I'm trying to say?
Yeah, I completely see what you're saying. I think obviously, there's going to be some elements that may feel more vet focused. But I think actually knowing about those things that are more vet focused help build that empathy for, like you were saying, those decisions that a vet's making in terms of, am I going to give this treatment to do a pain trial and then potentially risk the animal coming back with some other issue that's come as a result of that. And I think having that empathy, and I think being able to kind of relate to the worries and anxieties the vet's feeling, and then from the vet's point of view being able to relate to the worries and anxiety that a behaviorist is feeling or another professional is feeling is going to be a really valuable thing for building trust between those professionals. I think the more you can get that trust, so when someone is saying actually, I think this is something that we might want to look into, or on the other hand, a vet coming back to a behaviorist saying, actually, I don't think that this animal is showing signs of musculoskeletal pain. Actually, maybe we need to look in another direction or something like that. I think all of those conversations can feel quite fractious at the moment. And I think, the more that I think there is an understanding of each other's professions, the better for being able to communicate and kind of speak each other's language, or read each other's textbooks in your analogy. Yeah.
And I
what do you think, Amber?
Well, I think that's a really good point as well, to kind of spin it around, which is there has been an increased awareness of how pain can influence behaviour over the last 5-10 years or so. And because I'll lay it on the line, and I'm not blaming any individuals, and I hope that Daniel Mills published this piece of work in 2020, and within there is a figure from a single veterinary behaviourist who resides somewhere in the world, had said that they believed that up to 80% of the cases they were dealing with as a veterinary behaviourist might have a component to their behaviour problem that was based in pain. It was only a component of the problem, because quite often behaviour, well, almost always is behaviour is a jigsaw puzzle. And that jigsaw puzzle could be 2 pieces. It could be a 50-piece jigsaw puzzle. It could be a 100-piece jigsaw puzzle. And, and so pain could be one of those pieces, and that varies very, very much from case to case. And what I've seen happen over the last 5 years or so is, since that paper got published, is more and more professionals, some of them vets, a lot of them non-vet professionals, and some non-professionals themselves, start going 80% of behaviour problems are caused by pain. Now, that is not what that paper says, but that figure's got picked on. And I think it's put the veterinary profession under even more pressure than they already were at. And one of the problems we have is that the COVID-19 pandemic, with the increased number of pets that were purchased, a decreasing number of vets within professions, and that's in the UK. Obviously, it varies globally, from country to country, and this is a global discussion we're still having. But that vets are already under substantial pressure. So when they receive then a caregiver that just arrives and says, well, I'm here because my behaviourist or my trainer thinks that my dog's probably in pain, and that's where they're biting other dogs or barking at noises in the street. That's a real challenge for those vets because they don't have enough information. And actually, there's a fair number of cases where it isn't going to be about pain, or if it is about pain is such a little component that actually it's not that relevant in the overall picture. Doesn't still mean to say that the pain shouldn't be considered, but it actually isn't a substantial enough part of the contribution to the behaviour issue. And so actually, by thinking about it that way too, the more all of us, vets, non-vet professionals, non-professionals, can be educated about pain, how to consider pain, how to diarise pain, how to carry out pain trials or not carry out pain trials, the pros and the cons, how pain isn't always musculoskeletal, it can be in other parts of the body, how, like Dan was just saying about the emotional component, if you're in a more emotional kind of way, if you're a bit more pessimistic in your mindset at the moment, then actually a little niggle is going to be a big issue, even though actually we might think it's a little niggle. And when I look at I base that last one on myself and Beatrice's own presentation within
yes, tell us more about it, because I'm excited about this.
Within the symposium, of course, which is going to look at emotions and the role that emotions play in the pain experience itself, and then practically, what opportunities do we have, whoever we are, caregivers, professionals, vet professionals, what do we have as an opportunity to help shift that animal's emotional state so that they actually can perceive their pain in a slightly different way, modify their pain perception.
But can we just pause here, because this is really important. I have to just set the scene of why this lecture has come about. So I was listening to Beatrice, who is a very, very well respected, very, very well published veterinarian. She's devoted her career to pain management practices, clinical trials, lots and lots of research. So when I was listening to her lecture, and she boldly stepped away from academic language and went, happiness can affect pain state. And on stage in front of all these vets, to go so simple, so blunt, and so not what they were expecting, because vets are taught to manage pain with interventions, drug control, weight loss, they're all established. No one on the scene is saying, if we can improve their mood, we can affect their pain. I was like, oh my God, right, I need this lady. So I immediately paired Beatrice up with Amber, because I knew that the two of them would just gel. And we've got Beatrice that's very researchy, very academic, and Amber who's very practical and has been, talking about this for many years. That is going to be a bit of a blinder. Is it going to be a blinder, Amber? You're working on it at the moment, aren't you? Please say you are.
We've just finished it. It's not worth it. Don't turn up.
And this is about the. Am I right in thinking that you talk about the use of kind of distractions and things like that in terms of modulating pain experience? Is that what was in the title?
Well, that's what they've called it. Beatrice has given a different title.
Oh, okay. I read the schedule like I was told to. That's the one that I remembered from the lineup that Hannah sent me, and then you're like, no, you're wrong.
It might get modified by the time it actually gets presented, because the powers that be within CAM will tell us that's not the title that's on the schedule, Beatrice.
As long as you keep the sponsor happy, I think you're sponsored. But I will talk about that later. We'll just modify it.
The right topic. Okay, Bit is going to be explaining emotions and how emotions can affect pain and pain experience. Okay, that's what and well-being and welfare. And then I'm going to come in with a really practical of how do we observe dogs to know what emotion state they're feeling? How do we really do that? And then how do we take an individual, because what makes me happy is not what makes Dan happy. It's not what makes Hannah happy. It's not what makes my husband happy, blah, blah, blah. We're all different. We're all individual. And, and so we do need to get a better understanding and observation of our own individual animals and think what makes them happy, and then of course put that into context as well. Okay, well maybe chasing deer across 5 fields would make my Labrador happy, but she's had 2 cruciate operations and she's got arthritis in her stifle. It's not going to do her body any favors, is it? So what else makes her happy? So we have to, clearly we've got to think about it from the practicalities, but that's what we'll be looking at. So I don't know if it's not quite, for me, it's not distraction. It's more about engaging the positive emotional states within the body of that individual to help modulate their pain experience. And we could call that a distraction. When I'm happily eating hummus and crisps, which is one of my joys in life, do I experience my hip pain a little bit less because I'm focused on my hummus and my crisps? Yes. But obviously one of the things we must always talk about, and I actually talked about
weight gain.
Exactly. Weight gain. Exactly. And that's one of the reasons why I am not a big fan of food being predominantly used as the source of happiness for individuals. It's much better you make it alcohol.
Absolutely. I did a podcast today and I just went off on one about Prosecco for dogs. I couldn't help myself. They were like, we're supposed to be talking about Canicross today, Hannah? And I was like, but it's ridiculous. So anyway, I'm going to use a little bit of a springboard of what you've just been talking about, because I know as a first opinion vet, the idea of being able to talk about managing and modulating a pet's emotional state as part of a pain management plan is not in the scope of my 15-minute consult. It's not in the scope of what I can achieve in practice, in normal standard first opinion practice, but it is in the scope of all the canine professionals that then come upon that case. And what I'm hoping is that the vet doesn't poo-poo the concept, having been to the Chronic Pain Symposium and realizing how important modulating emotions are, so that when that caregiver goes, well, actually, I work with this trainer, this behaviorist, this hydrotherapist, and they have the ability with longer time, with potentially, greater opportunity to influence, they do take on that mantle and they do say, right, so part of your care plan, I know the vet's got your drugs on board, you've got you on a weight loss plan, we talked about supplements, you're coming to the hydrotherapy, but there's more that we can add, and it's so free of charge. It's instantly accessible. It's going to take you two on a bonding journey, because that's something that I'm very emotionally connected to. Is I see people as their pets develop chronic pain, the bond starts to break, and they start to have distance because there isn't the capacity to do what they once did. The expectations have changed. And this concept, I call it the rebuild. So upon a diagnosis, you're rebuilding the animal maybe physically, but you're also rebuilding this connection that caregiver had with their dog, the reason that they had the dog in the first place. And I'm hoping that when we learn together, we learn to also share the project. We're able to delegate the project. And I'm hoping that the vets go, do you know what, Carol, the hydrotherapist, awesome. I tell you what, I'd love you to check in. They've got some really great materials of what to also do outside the pool in between your pool visits. Do listen to her. It's really, really valuable stuff. Wouldn't that be amazing?
I think, and the cool thing is, kind of from the neurobiological side of it, it's working on the same pathways, right? Whether you're doing a treatment with a drug or whether you're doing some sort of behavioral intervention or a physical intervention, you might be doing something that like Amber was talking about, facilitating positive emotional experiences, facilitating things where the dog's attentional focus changes from the pain they're experiencing to something else. That's the same descending pathway as something like opioid treatment, in the sense that, I mean, they've looked at this with attentional studies. If you block opioid transmission in animals when they are changing their attention, it stops them being able to get the pain relief that you would get from eating your hummus and crisps, or something like that. It makes that function less well. So it's actually, and not that all chronic pain should be treated with opioids, I'm not a vet, but I do know that that's not gone particularly great for America. But I think it kind of highlights that we're all are kind of working on the same thing, and we can all be involved in working on the same thing.
Well, that's one of the lectures, just to kind of bring to people's attention. The amazing Bonnie Wright, she's a specialist over from America. She's going to be looking at the pain pathway, pain mechanism. I think pathway is just too simplistic now. And she's going to be talking about how different interventions, where they work, what's the mechanisms behind, and that be from medications all the way through to, say, photobiomodulation, laser. So that's going to be really interesting, where people can start to learn what could be quite a dry topic. Pain neuromatrix, quite a dry topic. It's intense, but they're going to do it with practicality of, I get why that could work now. And that hopefully is going to open people's minds to what this multimodal approach is about. A lot of people feel bamboozled by it. It's overwhelming. It seems a bit much. Is it necessary? So what I'm hoping is that, as with many other lectures, which have been carefully thought out for months, actually give people that confidence of, I get it. I know why we have to do multiple interventions at the same time. And what we talk about with multimodal, depending who you talk to, if you were to talk to somebody that doesn't understand the emotional influence on pain, they're going to be talking about drugs, supplements, weight loss, and hydrotherapy, or something of that combo. If you talk to somebody that's a little bit more informed and passionate about this topic, they're going to be talking about bringing leaves from the garden into the house for a less mobile dog to get pleasure. And I always love you for that, Amber. I always love you for that.
I was thinking that better not be somebody else that's been telling you that.
No one's taken that. I'm very respectful.
And I'm very glad.
Feces bringing in discussions, or has that not come up yet?
What? She did not.
Oh, I talk about all sorts of crazy stuff. I've got to that point where, yeah.
I'm very respectful for other people's work. So Mary Gardner.
I'll let Dan tell you about what I probably said about his.
What did you say?
Oh.
Well, Amber suggested, and I did this, that I collect poo whilst out on a walk to present to my dog for sensory enrichment. I think this was on your Facebook page, in a nice device, but some sensory enrichment from, I think it was bird. It was some kind of, it might have been cow dung or something like that.
Right, let's put this into context. First of all, he's not talking about dog poo necessarily. Okay, I want to just clarify that. He's talking about other animal poo. I think at the time I had come across a car boot sale, some sort of hanging device, mesh device that was into segments that people might put shoes or soft clothing like socks and stuff in, like an IKEA kind of thing. Swedish shops are available. And basically, and I'd done a video of how I'd collected some bedding from some animals, different types of, and put it into the different pouches. And because it was the animal couldn't eat it, my dog couldn't eat it, but she could sniff it all, you see. And I probably gave you that link, didn't I? So I was just pointing out that we can pick up different odors, some of which might be poo, as in it could be rabbit poo, as an example. But from a biosecurity perspective, we might not necessarily want the dog to eat it. So we can present it in ways where they can sniff it, but they can't eat it. And that's what he's talking about. I'd just like to point out it wasn't necessarily about going around picking up other things.
I love it. I think Dan's face says it all, though.
It did work great. I mean, she loved it. So
it did. She's a dog.
Yes, but that's exactly it. It's one of the things that's going to be I hope is going to be beautiful about the conference is that people that maybe see vet medicine as quite stiff, it's quite very physiological mechanisms, interaction, surgical, approaches. It's potentially going to be a bit uncomfortable for quite a lot of those, if that's how they're used to learning, because it's going to step into a slightly unconventional for the people that haven't been in our world for a while, isn't it? It's going to be interesting. So for all the people that are saying, I don't know whether it's going to be my level of capability, I'm a bit intimidated, I don't know whether I'm going to sign up. Don't be intimidated, and sign up, is free. But also think of all the people that are going with that academic level. They're going to be like, whoa, this is challenging. This has gone a bit grey. You're not black and white anymore. Not sure how I'm going to deal with this. So it's going to be interesting from all parties' perspective, Yeah.
It will, and we're reviewing some of it, right? Is that the other thing that we're going to be doing in a couple of months, which is quite exciting?
Yes.
Or not reviewing it like, this was terrible, but we're going to be reflecting.
7. No, yeah. So we're going to do that, and that's what's really cool is that after the event, we've chosen 2 lectures, and we're going to be having discussions like this. Mr. Hale is going to be joining us. And we're going to encourage people to have been to the event, because we're not expecting you to pay. You can attend live, or you can buy the VIP and watch it at your convenience. But we'd like you to watch the desired lectures and then join the 4 of us as we look at them again and discuss them further and dig deeper and make practical kind of translations. So if I remember rightly, we're going to be doing Sam Lindley's lecture, which is very much focused on what happens if we can't find the source of the pain. Where do we go from there? And I think this is hugely relevant in first opinion practice. Sometimes we don't find the source of pain. Sometimes we're not in the position that we could find the source of pain, be it the budgets, not just financial, time, emotional, social. We don't have the ability to go and dig deep and find where that source of pain is. Does that mean that the animal's not in pain? No, it does not. How do we work comfortably? How do we protect ourselves? How do we do the best clinical reasoning and approach without feeling vulnerable of the lack of knowledge? So that's going to be a really good one. I've already listened to it. It's amazing. Sam Lindley is a very good presenter. And then the next one is a human translation topic, which is going to open people's minds, possibly blow marbles, as the lovely somebody mentioned earlier, Zoe Carter. My brain was blown last year. So we got Ben Cormack. So he's a very well recognized physical therapist from the human sector. He's done a lot of work in different areas, but one area he focused on for a period of time was the biopsychosocial framework, which is a product of an amazing physician called George Engel back in 1977. But it was basically trying to demonstrate that all disease is unique to the individual because of their biology, their psychology, and their social situation. So no person's disease would ever be the same as somebody else's. There's just too many, variables within that. My broken leg on a desert island is going to be different to my broken leg just right outside A&E. Context to disease is really important. So when we get to review that as the 4 of us, I'm hoping that we're just going to open this kind of toy box of how can we really influence pain, and how can we do it within the caregiver's budgets. I'm going to say time, understanding, financial. We have the ability to really, really up our game in how we manage pain, and we're going to do it as a team. So as you can say, I'm quite excited about it.
No, I'm really excited. I think it'd be great. It's such a great idea to take a couple of those topics and really think about, just like you say, reflect on them, because not about critiquing them, as Dan just said. It's reflecting on what was said and what does that mean practically. What does that mean? You know, and then hopefully also encourages people who've got access to the other webinars at that point to go back and pick on a few of interest, and then pause and think, okay, well, how did we reflect on the ones that we've done together, and how could I then reflect on another, you know, another webinar as well, and expand for myself on that topic. And you know, and because that's what we need to do, isn't it? It's all very well listening to presentations and taking on board a few little key bits of information, but actually we have to digest it, and it takes time to digest it. It takes time to digest it and then be able to put that into a practical way that's going to work with the wide variety of cases that we're going to always be presented with, whether we are the guardian, the non-vet professional, or the vet professional. It's a brilliant idea. I'm really looking forward to it. And we're all hoping our technology works more effectively on that night.
Well, the other thing that I'm hoping that we achieve collectively, which we're doing tonight, is try and get rid of this vulnerability to learning people feel. And I know that I feel it, like as soon as you put your face above the parapet, like all of us do, because we do stuff online, it really makes you feel very, very vulnerable to criticism, not using the right terminology, not having the latest understanding. I'm hoping by having this kind of chin wag afterwards, we start behaving like a team again, and we feel confident to say, I don't know, tell me more. And you know, when Dan talks, sometimes he talks, I'm like, oh my god, it's an alien, I have no idea what he just said, but I can ask him because he's my mate, explain that again. And the same with Amber. Sometimes she just, you know, this lady can remember stuff. It really is intimidating, but I feel so socially comfortable with you two. I know that I'm not going to look stupid in your eyes if I was to say, can you say that again? Can you explain that to me? And I think what's happening in the world at the moment is that we are socially being put in a situation where we're too scared to ask because we're scared of somebody else's judgment. And I'm really hoping that we can start counteracting some of this in events like this, where we get mates together to go, well, let's sit down, have some hummus and crisps, and let's talk about it. That's the plan.
I'll be jogging whilst I'm eating the hummus and crisps, okay? Because if I'm still eating hummus and crisps at that point, then my osteoarthritis is not going to be good.
Yes, but let's play here a little bit, just to be a bit contentious. Do you feel there's an element of people feeling vulnerable, so becoming almost a little bit defensive aggressive in their behavior? Like when you feel that you don't know something, you kind of put on a front. And do you feel that it's good to try and address this?
Are you asking me that because we've been chatting on Messenger in the last few days?
No, not at all.
Oh dear. Yeah, everybody. I said it earlier, didn't I? I said, you know, people come into the grooming world, the training world, the behavior world, the veterinary medicine, veterinary surgery world, because we have egos, and that sometimes we might be a little bit narcissistic about it as well. And you know, I think that's and it's okay. Where's Dan gone? Have I
Dan's still here?
I'm still here. I'm good.
Oh, I see you. You've gone black.
That's just because I was flouncing off because you called me narcissistic.
I know.
He's left the building.
Yeah. I can't see you anymore, but apparently you're still there. I think we all have that in us. All of us, every single living individual, but certainly the humans, we have that, you know, and we have to acknowledge it. And you know, we do need to sometimes, like a jack in a box, make sure it hasn't popped out a little bit too much. We need to keep a lid on it a little bit. It's okay to have it because it's what gives us drive, it's what gives us confidence, it's what takes us forward, it's what makes us passionate in certain areas of our life. You know, there's nothing wrong with having that. but obviously we do need to keep a lid on it. And but sometimes the lid pops off and the little Jackie's jumped out a bit too far, and then sometimes we need to recognize that. And there will be times in all of our lives when our Jack in the box for our ego has the lid's been let off, and and sometimes we need to, hopefully what we can do, but what we hopefully are able to do is we're able to go, oh, actually perhaps at that time I could have put the lid on that a little bit more, and retrospectively we can go, okay, I'm sorry, I maybe just need to go back and think about that again, and I'm going to reflect on that a little bit more.
Yeah, absolutely. I think for me, and I wonder if Dan's quite similar to me on this front, because you're a listener and you sit there and you mull things over and you kind of reflect quite a lot. I wonder whether sometimes the behavior, the defensive kind of like I can't let my guard slip, isn't necessarily narcissism. I think some people, yes, but there is vulnerability. And I think I was very lucky to work with a vet many, many years ago who said to me, as my boss, it's okay to say you don't know. I'd rather you did that. I would rather you, as my clinician, to be able to say to my clients, I don't know, but I'm going to go and look it up, or I'm going to have a think about it, or I'm going to get back to you. And I feel really grateful to that vet all these years later that I now don't feel uncomfortable saying I don't know. I don't feel that it affects people's attitude towards me. If anything, there's an element of, she just said she didn't know. Freaking out, good on her. She's not going to make it up. She's going to pull it out her ass. And I wonder whether having a social scene where we all learn together, where it's okay to say I don't know, and there's so much more I need to know. Do you think that's going to help?
I do. Yeah, I think it's so almost innate, isn't it? If you feel someone criticizing you or questioning whether you know something and you're trying to do something, to kind of have that defensive reaction. But I think, sometimes it can be an opportunity to maybe find something out or learn something from someone else. It's difficult, isn't it, on social media? Because we all have, I guess, social media pages, right? And some people just write something just because they hate you, and you're like, okay, that's fine. You, but then some people do have genuinely good feedback to that might inform you of something you don't know, or might open something up to you that you're not aware of. And I think it's very hard for us as humans to differentiate between those two things of kind of, is this just someone, just some spouting nonsense online, or is this actually something that might be useful for me to look into? Would it be helpful for me to learn more about this? So I think, yeah, it's really difficult, isn't it, to say you don't know something? But it's
if you say it often enough, Dan, it gets fine. Just practice.
I tend to do it as if you can do it as a precursor when you start off one of these things, then you set expectations low, and then if you know one
absolutely
thing,
that's why I knew I could
blown it out the park.
No, so we're coming up to an hour, and everybody's got lives, everybody's got things. Amber's got to have a gin and tonic. She's had a very tough weekend, and I'm very conscious that we're holding her back. Is there anything that you guys would like to add? I'm very grateful. Huh?
I've been hassled by Dachshunds today. Hassled by Dachshunds.
Oh, our internet.
Put under a lot of pressure by Dachshunds.
Oh, hassled by Dachshunds.
I was worried I was going to get ripped apart by a German Shepherd, but it turns out it was the Dachshunds that gave me the grief.
It's always the Dachshunds.
Always the Dachshunds.
That sounds like a band, hassled by Dachshunds. It's just something else. Yeah. No, I'm really grateful for you two giving up your time to kind of help me promote the event. We want lots of people to attend. Is there anything else that you would like to add? I will definitely let people know when we're going to do these review opportunities. But before we say goodbye to everybody and thank you for listening, anything else you'd like to add?
It's going to be brilliant. I'm really excited for it. I think everyone should get the VIP
We've
pass.
broken down
You
communication.
Am I here? Is anyone?
You're here.
I'm here. Oh, Hannah's gone.
Everyone's here. Everyone's here. Yeah.
Oh.
I'm here.
Okay,
yeah, I'm very here.
I wasn't sure what was going on, but I was just saying. I think we all should sign up to it because I think it's going to be great. And that you can't say it, Hannah, because you're organising it and you're a very humble person. But the VIP pass is fantastic, and it literally gives you a year's access to all these amazing lectures. And they're not like they're also so many of the lectures are kind of double team, like Amber and Beatrice. And so you get kind of 2 for the price of 1 with each lecture. So it's just going to be really cool. I think you don't get much like that. I mean, I don't even know how you manage to buddy people up like that from a kind of logistical level, in terms of managing people's schedules. And
it's quite difficult, and it's very expensive. It basically doubles our speaker fee. It's just like, oh my God.
Yeah, well, and so I think, are we here? We're still here?
Yeah.
Yes, we're here.
I think, what I would like to say is, I think whether you decide you want to sign up or not, and whether you want to join up or not, I mean, if you've got this far into the conversation, you're clearly aware of Canine Arthritis Management, and you're clearly aware of all the effort that gets put in. So, even if you do not attend the symposium, I want to make sure that people are aware. There's been a huge, I mean, it's an enormous feat, right, to do what you've done, because, I mean, I attend conferences regularly, and there might be, I mean, the conference I was at this weekend, I think there might have been 8 to 10 speakers, okay? And, and that's a big feat to pull off. What you're pulling off is supernova stuff, yeah? And I hope that does inspire people to go, okay, well, with all of those speakers and with all the topics we're covering, and the ability to get it at either free or at a really good price if I want a year's access, that's got to be worth it, hasn't it? But even if you don't feel that you can invest the time, the emotion, the finances in that, the fact that you've got to 56 minutes into here tells me that you really appreciate CAM, and any way that you can continue to appreciate it, if that's just sharing it amongst other members of the profession that you work in, or area region that you work in, even though you're not going to be able to attend, you don't want to attend for yourself, share it, let more people know, because even if you can't or don't want to, I know that you've got to 57 minutes now, so you must be invested in trying to help animals with the pain journey and their caregivers with their pain journey. So share it so that more people are aware and can join if they want to. That's what I want to say. Because
that's exactly
an amazing thing, setting up CAM, and a mind-boggling thing, with all her wonderful team of people to get the symposium going again this year. And as many people as can benefit from that, is just what we need.
Thank you. And that's exactly what our ultimate goal is. This is going to be like a nuclear bomb of chronic pain understanding going across the world, in that we've been working really hard to get into all corners of the globe. We've got outposts over in New Zealand, Australia, Asia, Russia, all areas of the world. We are trying to get people to come and join and learn together. We've got a company in China that's translating it all into simplified Chinese, so it can go out all across China after the event. Huge amount of work to bring this together. So fingers crossed, hey guys, and help us spread the word. Thank you too so much. I will make sure that we have all the links to get to the registration page after the event here. I will definitely keep you guys aware of when we're going to be doing these post-event discussions. So please keep an eye on CAM and these guys' pages. But thank you very much for joining us tonight. It's lovely to see you all. Thank you, you too.
Thanks, everybody.